Can you stop share this for a moment? We can reshare, na? Yeah. Very good evening to all my dear MOS members, non-members, pan-India. Hello. Can I start?
Yeah, carry on.
You can start.
Yeah. Yeah, a very good evening to all my dear MOS members and the rest of the ophthalmologists, the ophthalmic fraternity, postgraduates, fellows. Welcome to the fourth round of our round robin Clash of the Titans. We have been having a very good response today also. Little bit of the technical glitches, but they are also taken care of. I am sure the best of the talent is going to win this. We have got 4 prizes. The details of the rules and regulations, the quiz masters are going to tell you. So welcome you to this grand quiz and all the best, everybody, all the participants. Thank you very much. Over to you, Dr. Ramesh and Dr. Sanjay Shah.
Yes, sir. Thank
Please
you, Dr.
screen share.
Taswala.
Yeah.
Thank you, Dr. Taswala. I hope everybody can see the screen, sir.
Yeah.
Yes, okay. So I welcome everyone to this fourth Maharashtra Ophthalmic Society quiz. My quiz master today is Dr. Sanjay Shah, and I am the second quiz master, Dr. Ramesh Murthy. We'll start with the rules first, and I'm sure this is going to be a very exciting quiz. So the rules are that all MOS members and non-members can also participate in this quiz. We have 40 questions, and there is only one correct answer for each question. The duration for the answer is about 20 seconds, not 30 seconds, 20 seconds. So when you see the question, you can answer immediately. So when we assess, we are looking at the correct response and also the fastest finger first. So it matters that if you know the answer, you click the button right away. There will be 4 winners, some special audience prizes, which is quite a bit of a secret, according to Dr. Taswala. If there is a tie, then 3 questions will be asked, and the contestant with the maximum correct answers will qualify for the respective, will be the respective winner. The eligibility is that all can play and win, but to claim the prize, all have to be MOS members. And the most important rule is that the quizmaster's decision is final. So, Saif, I've just started with the first question.
Please go ahead, Doctor.
Just ask them, everybody ready? First, all have logged in. Are they on Slido? Please ask all this. Once they give a thumbs up on the chat box, I think we can start. Wait for a minute or so, because some people are on the Slido yet to join. See, I can see people are still joining. Now 45 users. It was 37. Yeah, Arjun Arora has given a thumbs up. So quick thumbs up, everybody. If you are already on the Slido, we are ready to start the quiz. Dr. Ramesh Murthy is going to ask you the first question. Please quickly on the chat box, give us a green signal to start. 46 users already joined. See, the people are increasing. So we need to wait for about a minute or so. Okay. Ramesh, I think you start, chalo. Whoever is there.
So we start with the quiz now. We'll go on to the first question. First question is, which clinical feature is not a characteristic of Fuchs' heterochromic uveitis? Option A is iris atrophy, option B, glaucoma, option C, posterior synechiae, and option D, posterior subcapsular cataract.
Time is over.
Yeah, so the 20 seconds are over. We'll go on to the answer. The answer is posterior synechiae. It is not a characteristic of Fuchs' heterochromic uveitis. Question 2. Which feature is not found in patients with Eve's disease? Repeated vitreous hemorrhage, choroidal inflammation, neovascularization of the retina, and optic nerve edema.
Time starts now.
So the time is up and we'll go on to the answer. The answer is choroidal inflammation. We'll go on to the third question. Which of the following is not helpful for the diagnosis of sarcoidosis? Number one, serum AC levels. Option B is HRCT of the chest. Option C is Mantoux test. And option D is lymphocytosis. Your time starts now. The time is up, and the correct answer is lymphocytosis. Let's go on to the fourth question. So this is about the cornea, which I'm sure everyone will be able to answer. True about the posterior surface of the cornea is. So what is true in this? Option A, it is more steep horizontally than vertically. Option B, its curvature varies linearly with anterior corneal curvature. Option C, it has a negative convergence power. And option D, its curvature can be measured by autokeratometry. Your time starts now. We had put a cross section of the cornea in case it gave any clues. So the answer is true about the posterior surface of the cornea is it has a negative convergence power. Now we go on to the next question. Which of these topography devices does not use a Scheimpflug camera? Option A, Opscan topographer. Option B, Pentacam topographer. Option C, Galilei topographer. And option D, Sirius topographer. So it is A, B, C, and D. Sorry for the typo error. So the time is up, and the correct answer is the Opscan topographer. Let's go on to the next question. This is a very simple question on basic refraction. A patient's refraction reads plus 1.75 and minus 1.5 diopter cylinder at 70 degrees. Which of the following statements is false? The steep meridian is 160 degrees. Option B, it is against the rule astigmatism. Option C, it is mixed astigmatism. And option D, the spherical equivalent is plus 1 diopters. I think this was an easy one. And the answer is, it is a mixed astigmatism, which is a false statement here. Now this should be really easy. This is about pterygium. Which of the following is true about pterygium? Option A, the probe can be underneath the pterygium at the limbus. Option B, it is associated with exposure to infrared radiation. And option C, the Bayes-Clera technique has 30 to 80% recurrence. And option D, elastotic degeneration with distortion of the Descemet's membrane is seen. Your time starts now. So the following is true about pterygium. The Bayes-Clera technique has 30 to 80% recurrence rate, and most of you have got it right. So that's a very good sign. So we're going the right direction. I'm sure we'll find some good winners here. So let's go on to the next question. The KF ring or the Kayser-Fleischer ring is seen due to option A, copper deposition in Bowman's membrane. Option B, copper deposition in stroma. Option C, copper deposition in epithelium. And option D, copper deposition in the Descemet's membrane. And of course, in option E, all of the above. I've got a quick picture of the keratoconic cornea for your reference. I'm sure all of you will get it right this time. So this was an easy one. Let's look at the answer. So the KF ring is seen due to copper deposition in peripheral Descemet's membrane. And nearly 90% of the people have got it right. So that's a very great and a good sign. So let's go on some more questions. This is also about the Fleischer's ring. Now this is seen, the option here is option A, seen in keratoconus at deep epithelial level due to deposition of iron. Option B, seen in keratoconus at deep epithelial level due to deposition of copper. Option C, seen in keratoconus at endothelium due to deposition of iron. And option D, seen in keratoconus at endothelium due to deposition of copper. And option E is none of the above. So keratoconus is a common problem that we see in our daily clinical practice. And we must remember that there are two distinct rings, the KF ring and the Fleischer's ring, and both of these rings are different. So the Fleischer's ring is seen in keratoconus at the deep epithelial level due to deposition of iron. And I'm sure most of us would have seen this. So here again, nearly 80% of the people have got it right. So it's a very welcome sign. Now let's go on to question number 10. This is a very easy question. The histology of pterygium is option A, elastotic degeneration. Option B, epithelial inclusion bodies. Option C, precancerous changes. And option D, squamous metaplasia of the epithelium. Your time starts now. Maybe the picture on the right will give you some clues. So the correct answer is the histology of pterygium is elastotic degeneration. And I think, yeah, more than nearly 95% got it right. That is a very good question and good answers by everyone. Now I'll request Dr. Sanjay Shah sir to ask the following 10 questions. Shah sir, I'm going for the next question, question number 11. You please read the questions.
Question number 11. Which of the following is a lead sharing procedure? Tenzel's flap, Mustard's flap, Hughes flap, and McGroge's flap. Your time starts now.
Sir, I could not give pictures here because it will be very obvious. Na, sir, I could not give any picture
Yes,
here.
yes. Your time is up. Answer is
So the Hughes flap.
Hughes flap. Yes.
Yeah, here what we do is we share the tarsus and the conjunctiva. So it's a lid sharing procedure. All the others are extension flaps, sir.
Yes. Next question. The radiological investigation of choice while diagnosing rhino-orbital cerebral mucormycosis is A, CT scan, B, MR angio, C, MRI with contrast, and D, orbital ultrasound. Your time starts now.
So we had a lot of rhino-orbital mucormycosis last year, and many of the ophthalmologists and the students would have seen these cases. So this should be really easy for them.
The time is up, and the answer is MRI with contrast. Yes, 76% have answered right. Next is which of the following is not a material used as a suspension in tarsofrontal sling? A, silicon, B, silk, C, vicryl, D, ethibond. Your time starts now. Time is up. Answer is C, vicryl.
Because it is an absorbable material, it will absorb and the
Yes,
sling
so-
will not work, sir.
Yes.
So we go on to the next question. Sir, this question.
Next question. The most sensitive test for ocular myasthenia is penicillin test, EMG, ICE test, and D, anti-acetylcholine receptor antibodies. Your time starts now. And the time is up, and the answer is
It's a very interesting question, sir, with interesting answers, sir.
yes, ICE test.
So, as you can see, very few people got it right.
Yes.
Because they underestimate the importance of ice in front of other
Next one.
machines.
Hyaluronic acid is present in A, aqueous humor, B, vitreous humor, C, lens, D, cornea. Your time starts now. I think it's an easy question, a basic question. And the time is up. And the answer is vitreous humor.
A very
Next
basic
one.
anatomy question.
A patient presented with unilateral proptosis, which was compressible and increases on bending forward. No thrill or bruit was present. MRI shows a retroorbital mass with enhancement. The most likely diagnosis is A. AV malformations, B. Orbital encephalocele, C. Orbital varix, D. Neurofibromatosis. Your time starts now. Time is up. Your answer is orbital varix, C. Yes, most of them have given the answer. 68% have given the answer. Good. The following ocular structure is not derived from surface ectoderm. A. Crystalline lens, B. Sclera, C. Corneal epithelium, D. Epithelium of lacrimal glands. And your time starts now. The time is up. And the answer is B. Sclera. Next one.
Sir, many people got it right. So people's anatomy is very good. Basic knowledge is very good, sir.
Yes. Which one of the following statements concerning persistent hyperplastic vitreous is true? A. It is generally unilateral. B. Visual prognosis is usually good. C. It is calcify. It may calcify. D. It is not easily differentiated from retinoblastoma by the presence of exophthalmos or cataract. And your time starts now. Time is up. Answer is it is generally unilateral.
It is usually having very poor prognosis for vision. So this was a pretty easy question.
Yes.
But still about 40% of the people got it right. So we'll go to the next question.
Two stereopsis is perceived due to the following. A. Overlay of contours. B. Motion parallax. C. Binasal disparity. D. Linear perspective. Your time starts now. Time is up. Answer is binasal disparity.
So there is no negative marks. Everybody can give a try, I think.
Yes.
And we can see that about 50% of the people got it
49%
correct.
right.
Yes.
Yeah, 49% got right.
So it's question
All
number
are to
20.
extend.
So I'll
All
go
are
ahead, sir,
true
from here.
except-
Next 10 questions, sir.
The
Sanjay, sir, I'll
oculomotor
start. Sir,
oculomotor
I'll start
nerve
this switch.
provides motor supply to the levator palpebrae superioris. B. Innervates the superior, inferior, and medial recti. C. Carries the sympathetic supply to sphincter pupillae. D. Supplies the ciliary muscle. And your time starts now.
Sir, we have got a nice picture here. So people can see that it
Right.
answers the question.
Answer is C. Carries the sympathetic supply to sphincter pupillae.
So
We have
sphincter
completed
actually-
20 questions.
Yes.
Now I request Dr. Ramesh to carry forward for next 10 questions.
So this was a very easy question and easy answer for that. So let's go on to the next question, which is not a feature of VKH disease on OCT. Option A, focal excavation of the choroid. Option B, subretinal fluid. Option C, choroidal granulomas. And option D, compartmentalization of fluid. We're talking about OCT here.
Time is up.
So focal excavation of the choroid is not a feature of weak age disease on the OCT. Next question, all are false except about the bones of the skull. Option A, unite at mobile joints called sutures. Option B, is covered on the outer surface by periosteum. Option C, all are paired. Option D, all contain air sinuses. Option E, continue to grow after puberty. So the correct answer is it is covered on the outer surface by the periosteum. So the most appropriate test for this patient is, so look at the picture carefully. A, blood pressure measurement. B, ANA. C, chest X-ray. And D, CD4 count. Look at the retina picture carefully. There's a retina problem. So the correct answer is the CD4 count. So this patient has CMV retinitis, which is found in the immunocompromised individuals, and CD4 count is very valuable test. Next question. The steroid that is least likely to cause posterior subcapsular cataract is option A, dexamethasone, option B, prednisolone, option C, loteprednol, and option D, triamcinolone. So this is a pretty easy question, and I'm sure many people will get it right.
Great going, Ramesh. Very nicely put up.
So the answer is option C. The steroid that is least likely to cause posterior subcapsular cataract is loteprednol. So this is an ester steroid with minimal to no cataractogenous properties, and all the other steroids are ketone steroids, which have a potential to cause cataract. So this particular answer, about 97% people have got it right. So that is really remarkable. So the next question is, the glaucoma medications associated with decreased conjunctival goblet cell density are A, prostaglandin analogs, option B, selective beta blockers, option C, non-selective beta blockers, and option D, alpha agonists. We are aware that most of the glaucoma medications cause a lot of side effects. So decreased conjunctival goblet cell density will occur because of the non-selective beta blockers like timolol. They also reduce the corneal sensitivity. Okay, about 27% of the people got it right. So next question, management of corneal edema secondary to endothelial dysfunction can include the below, except A, hypertonic saline drops, B, endothelial transplantation, DSEC or DSEC, option C, full thickness penetrating keratoplasty, PKP, and option D, anti-lamellar transplantation, ALK. We have corneal edema secondary to endothelial dysfunction, and we are looking at the management. So time is up, and the only thing which is not done is anti-lamellar transplantation. So the next question, Which of these methods is least reliable for detecting early post-operative raised intraocular pressure following LASIK? A. Digital. B. Shear tonometry. C. Goldman appellation tonometry. And D. Non-contact tonometry. Time is up. So the least reliable is the Goldman appellation tonometry for looking at any kind of raised intraocular pressure following LASIK. So again, only about 16% of the people got it right. Most people got it wrong. Now the next question. In acute viral anterior uveitis due to varicella, which features are not found? A. Severe vitritis. B. Diffuse or sectoral iris atrophy. C. Cyclitic membrane. And D. Hypopyon. Time starts now. We have put a nice picture for you to look at that and answer the question. So the time is up. So in acute viral anterior uveitis due to varicella, cyclic membrane is usually not found. The next question. Which of these procedures is not a preferred surgical treatment option for keratoconus? Option A, Intacs. Option B, topographic guided photorefractive keratectomy. Option C, phototherapeutic keratectomy or PTK. And option D, Contura LASIK. Time starts now. So the time is up, and the option which is not a preferred treatment option for keratoconus is Contura LASIK. All the others like Intacs, even PTK and others are very good options for treating keratoconus. And nearly 46% of the people got it right. Now question number 30. Again, an easy one. Which is not a type of congenital cataract? Option A, sutural. Option B, papillary. Option C, coronary. And option D, lamellar. And the time starts now. We have a congenital cataract picture just so that you can look at it and give the right answer. So the time is up. Which is not a type of congenital cataract. The papillary is not a type of congenital cataract. So we have finished nearly 30 questions, and I think it's great going so far. Taswala sir, how is it? How is the quiz?
Very nicely conducted, short and sweet. This thing, not very difficult and not very easy also. Of
Yes,
course,
some of them are easy, some of them are difficult.
Yes, so that is how it should be. It's a mix and match, and very well conducted. Both of you are going great guns. The last 10 questions now by Dr. Sanjay Shah.
Yes, sir. Request Sanjay Shah sir to kindly go for the next 10 questions.
So we are on the last 10 questions.
Yes.
Next question is, which type of cataract is associated with increased risk of capsular rupture during cataract surgery? A, posterior polar. B, sutural. C, anterior subcapsular. D, posterior subcapsular. The time starts now. Everyone should be able to answer this, I suppose. And the time is up now, and the answer is posterior polar cataract.
So we are all scared of posterior polar cataract, and we keep a watch for it.
Every cataract is scared of posterior polar cataract. Next one, 95% have answered right. Microsclerophakia is not associated with Alport syndrome, B, rubella, C, Peters anomaly, D, syphilis. And your time starts now. Time is up, and the answer is syphilis. Microspherophobia is a small discoid lens, usually isolated hereditary occurrence, but can be associated with Alport syndrome, Lowe syndrome, rubella, Peters anomaly, Marfan syndrome, and most notably Well-Marchesani syndrome. It is not associated with syphilis. Next one. This patient needs Botox. Which muscles will be targeted? A. Frontalis plus orbicularis, B. Corrugatus plus procerus, C. Orbicularis plus procerus, and D. Corrugatus plus nasalis. And your time starts now.
So patient is angry look or sad look, sir? So we have to find out if it's angry look, then we have to give the right muscles.
Angry looking. And time is up. And the answer is corrugator plus procerus. This patient had a glabular region injected, which includes the corrugator supercilla and procerus. Contraction of frontalis creates horizontal forehead wrinkles. Contraction of orbicularis creates crow's feet, and contraction of nasalis creates money lines around the nose. Next one.
So about 50% of the people got it right.
Yes. Ectopia lentis is in a patient with Marfan syndrome is typically in which direction? Inforotemporal, inforonasal, superotemporal, supernasal. Again, another easy question.
Sir, quiz cannot be unilateral, which means it should not be extremely tough also, sir. Otherwise, there's no
Yes.
fun.
No, it should be a mixed match.
Mixed match, yes, sir. So we'll reveal the answer now.
Time is up, and answer is superotemporal. Yes.
So let's look at the, about 92% got it right, sir.
92% have answered correctly.
It's very good going.
Next one. This lesion has been present for many years and patient has no symptoms. What is the most likely diagnosis? See the picture on the nasal canthus. Apocrine hydrocytoma, hydrocystoma, basal cell carcinoma, chronic dacryocystitis, sebaceous cell carcinoma.
So here the picture is telling everything, sir.
Yes, picture. I picked a picture.
Shah, sir?
And the time is up. And the answer is apocrine hydrocystoma. Next one.
So we can read the answer. It is a fluid-filled cyst which is present for a long time. It is a benign cyst and usually rests at the medial canthus, sir, and not over the lacrimal sac area. Sir, 87% got it right. About 8% said it is chronic dacryocystitis. And 5% feel it is sebaceous cell carcinoma.
Carcinoma, yes.
Five more questions to go.
Last
So
5
the
questions.
Count out begins.
So the
One.
word cyst was there on the answer. So it is a cyst actually.
Shield ulcer is seen in fifteen-valve conjunctivitis, spring catarrh, herpetic keratitis, and fungal keratitis. And your time starts now.
Sir, we are seeing shield ulcers now, sir, because of this month, no? March and April.
Yes.
Summer, yes.
We're seeing spring.
Some clue for the answer.
Mm.
You are giving clue for the answer.
It's been a big clue, yeah. इतना बड़ा clue मत दे देता.
Sir, time is up and please.
And the answer is
100 correct आएगा अभी.
So we are on the last 4 questions now. Next
So
one.
90% got it right and about, few people got it wrong still. Give the answer also in the weather.
Yes. The confocal scans are consistent with Acanthamoeba keratitis, Pseudomonas keratitis, Fusarium keratitis, and Staphylococcal keratitis. And your time starts now. See the picture. That can give you a clue what the answer is.
Seconds remaining, and your time is up.
And the time is up. And the answer is acanthamoeba keratitis.
I think there are only 2 more questions to go, no, sir?
Yeah, 2 more questions too. Yes.
And three more to go.
Which muscles need Botox in this patient? A. Frontalis, B. corrugatus, C. procerus, D. orbicularis oculi.
Come on, folks. Only 3 more questions.
Sir, this question has already been answered. If somebody carefully heard what we said.
You want to take one more instead of that?
No,
Because this
sir,
is
no,
very
no need to
obvious.
say.
No,
I'm
no,
just
no, no.
saying.
No,
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 not
very-
at all, sir. We didn't answer the question directly.
Okay.
First question.
We didn't answer the question directly. It was there in one of the answers. If people carefully had
Yes.
looked at what we said or heard
They
what
can
we
answer
said, they
the
would have known.
question. Time is
That's why
up.
majority have given it right.
Yes. Frontalis muscle is responsible for elevation of forehead and produces horizontal wrinkles across the forehead. Contraction of the corrugatus and procerus is responsible for vertical glabellar lines between the brows. The orbicularis oculi muscle is a concentric muscle around the eye that upon contraction produces classic profit seen at the lateral canthal area. Next one.
So
Last
about
2 questions.
87% got it right, sir.
87% have answered correctly. Yes. All the bones are part of medial wall of orbit except ethmoid, maxillary, sphenoid, zygomatic. The time is up and the answer is zygomatic.
So 92% got it right.
92% have correctly answered. Now we are on the last question of 4th quiz.
Question
The
number
various
40.
particles in hysteroid hallucis are composed of hyaline, cholesterol, calcium, and amyloid.
So time is up. Shah, sir?
Calcium, yes. 59% have answered correctly. So we are finished with all 40 questions and we are waiting for the results now. Dr. Taswala will announce the results.
Yeah. Hold your breath because it's been
Hope
a very,
everyone-
very interesting quiz conducted by Dr. Ramesh Murthy and Dr. Sanjay Shah. And we have the results with us, Dr. Kaushik Tripathi. Now here, as we just announced the rules, those who are MOS members will be able to claim the prizes. Of course, you have won it, but if you have to become an MOS member to claim. So the 4th prize goes to Dr. Arjun Arora. Is Arjun Arora there? Can you take them into the Zoom this thing? Upgrade them?
Just a minute, doctor.
Yeah. It's actually a tiebreaker between the 4th and the 3rd. Jai Prashad Bhaskaran is the 3rd prize winner. 30 out of 40 questions are correct. Arjun Arora also 30 out of 40. So, but the fastest finger is showing that within 5 seconds he is given, and Arjun Arora has given 5.38. So that is why the 3rd and the 4th prize. 2nd prize goes to Mr. Sudan, 31 out of 40. And the 1st prize goes to Kaushik Tripathi, 36 out of 40. Great going. Mr. Sudan actually fastest fingers first, 3.31. He's been answering very, very fast. So all of you, big congratulations. Kaushik Tripathi has got the 1st prize, 2nd prize to Mr. Dr. Sudan, 3rd prize to Jaya Prashad Bhaskaran, and 4th prize goes to Arjun Arora. So congratulations, all of you. Are you all the members of the Maharashtra Ophthalmological Society? Please let us know.
I am not.
Okay. So it'll be nice if you can become, so you can claim the prize also. There are surprise prizes. We won't disclose now how much everybody is getting it, but we would definitely like our MOS member to get it. So please become an MOS member. That's an earnest request to claim
I'll
the
consider.
prize. The
Yes, sir.
microvision
I'll
people.
also become a member.
Yeah, Arjun sir, you also become a MOS member if you're not. Who else is there?
I'm not an MOS member.
Sudan is also not. So non-MOS members have won the prize. That's good. So please become an MOS member. We'll be handing over the prizes to you at your place by the microvision people once you become the MOS member. Okay. So the procedure will be, we have your mobile numbers. If you can share your mobile numbers on the chat box, Dr. Rajesh Joshi will note down and he'll also contact you. Or you note down Dr. Rajesh Joshi's number too. Rajesh, can you put it on the chat box?
Yes, sir. Sure, sir.
Yeah.
Sure.
So please contact him and become one. So within the next fortnight, we'll be sending you prizes once you become the MOS member. The procedure is about 2 to 3 days to become an MOS member. So Jai Prashad ji, I mean, Dr. Kaushik, is he there? I don't see him.
Yes, sir.
Arjun,
I am yes.
see him. Yeah,
I am not
Kaushik
a member.
Tripathi,
I am
congratulations. All the
Thank you.
winners, a big congratulations. Good that you have come and participated in this Clash of Titans. And this is what is seen. Okay, our MOS members, more than that, we have the people outside Maharashtra who are claiming prizes. So nice of you. So please visit mosi.org and apply for membership online also. We have started the online platform, so you can do it directly. The procedure is very short. One is you go visit that, 2 MOS members, if you can get it, fine. Otherwise, you have 2 iOS members you can put in. Have you made the arrangement, Sai, for that? 2 MOS, 2 iOS members, because they'll be outside Maharashtra.
With AOS members, not yet, but with the MOS members, it's live now. Doctor.
Okay. What you can do is they will be providing to MOS members. If you know somebody, fine. Otherwise, 2 of us will say that, Papa, you are known to us, proposer, and seconder. We'll do it that way. That's very easy. And you have to pay 2,500 live membership. So many of the things that you are having it. One is the quiz. Then we have MOS International Fellowship that we are starting. Then we have mentor and mentee programs going on. Diabetic awareness is going on. Financial literacy programs are going on. So it'll be a big plus for you people once you join. You'll come to know the value of becoming an MOS member. And we are one of the second largest society in India. So please be part of our MOS. So thank you very much once more for joining. Please put in your cell numbers also. Dr. Rajesh Joshi will quickly note down, and it will be both ways contacting each other, so you don't lose on the prizes. They are very attractive prizes. A big thank you once again to Sai for all the support, microvision people who have done a great job helping us running this show month to month for the whole of my tenure. And of course, our quiz master, Dr. Ramesh Sanjay Shah. Yeah, Jai Prashad ji. I think he is noting it down. Dr. Rajesh Joshi is. You can take a screenshot if you are on the mobile, Rajesh.
Yes, yes.
So you'll have everybody's with the name, so it's not a problem.
Will
And
I
it's
get
nice.
the right to vote? If I become a
Right,
live
sir?
member, will I get a right to vote?
No,
Voting rights?
no.
Except for right to vote, I think, and the office bearers, if you're outside Maharashtra, rest of all the facilities of the scientific programs and MOS platform, you'll be a beneficiary. Don't worry. That is the way for all the states. If you are residing within, you have the right to vote.
Okay.
Otherwise, only that and the office bearer you cannot become. Rest, all
Yeah,
the scientific
that's right.
programs you'll be attending, and all the benefit discounting, whatever we give, prizes we give, you'll be eligible for that. So I think everybody has shared their phone numbers. It's past exactly 10:30, 1 hour flat. We have finished the quiz, and more so, you can always come and rejoin for the future quizzes. We'll be going right till the finals in the MOSCON 2022 at Nasik. We'll have physical quiz going on where the finalists, all the finalists of this will be chosen and given a chance. So be there that time in Nasik. So that is more so of becoming an MOS member. Rajesh, everybody has shared the number.
Yeah, yeah.
He is the honorary secretary. Official thanksgiving from you too.
Yeah.
These people have joined. It was a lovely quiz, very well conducted by both of them, and with a good backing by Sai. Over to you,
Yes.
Rajesh.
Yes. This is, I think, the most interesting session for which most of the members are waiting. In fact, not only MOS members, but AIOS members also, or members of many societies. Questions this time were mix up of simple and tricky as well. They were a bit difficult and the simple also. The two ends, you can say. I applaud the initiative of President Dr. Jignesh Taswala for this wonderful initiative and congratulate all the winners and participants as well. Many thanks to Dr. Sanjay Shah and Ramesh Murthy and all the quiz committee members for the efforts to conduct the quiz and making it interesting and informative. Thanks to Microlabs for sponsoring prizes and Numerotech for the technical support. Thank you so much. And again, I congratulate all the winners.
Let's have the gallery view photograph with the winners. Put your video on, Sai. Can you take the gallery view photograph quickly? That is for the posterity, and we are going to have it on the website also. These are the winners. Mr. Dr. Sudan, can you put your video on, please? And who is the fourth person? Arjun Arora is left, I think. Anyway, so a quick photograph. Hearty congratulations for winning the coveted prizes. Soon you'll be getting it once you become the MOS member. Thank you. Sai, have you taken a photograph?
Done, doctor, done.
Done. Thank you. Thank you very much.
Sir, is there any prize for quiz masters? Sir, any prize for the quiz masters, sir? Any prize for quiz
we'll be giving
Oscar.
it. Yes. We have plenty of prizes for the quiz masters also. Don't worry. You have taken all the efforts. We're going to do it. So, thanks all of you. New people have joined. New people have won. That is the reason why we are having the perpetual quiz every month. And we are going to go on till the October end. So, be with us. And do join all the quiz. Maybe next time you might not get it, but you'll love to. The knowledge will be upgraded. And very quality conscious quiz is done by the quiz masters. We have a quiz committee. Dr. Kuresh Maskati is the chairman of that. We have about 25 members in that who are contributing various question and answers and the options. I hope everybody loved it. Any changes you'd like to have, the winners, please give us an input and a feedback, please, before you sign off. I am Dr. Jignesh Taswala. I am the president of the Maharashtra Ophthalmological Society.
Yes,
My
Dr.
team, it's the brainchild of my team this time, the managing committee, to have this perpetual instead of only one in a year. Any suggestions, please let us know.
I think it can be a little more difficult. Questions actually can be a little more difficult.
Okay.
Me being a very senior person into practice, see, I am able to answer. Yeah. So I think it should be a little more of a higher standard, so that little more tough actually, so that people who has really read or who keeps themselves updated can win the prizes. That is what I feel.
Definitely. Definitely we'll take this point, Jaiprasad sir. In fact, last quiz was very difficult, so we had to lighten it.
Okay,
very
so I'm lucky.
Answer it correctly.
So just because this came in a mail to me today, the link, I thought, okay, let me play this. That is why I joined actually. I am really glad to have met all of you on this forum. Of course, I used to come to MOS meetings. I had come actually a few times.
Where are you placed, sir?
I am at Trivandrum, Kerala. Trivandrum,
Kaushik,
Kerala.
where are you? Okay. Kaushik, where are you?
Sir, I am at Kolkata, sir.
अरे वाह, देखो कलकत्ता कहाँ, त्रिवेंद्रम कहाँ और महाराष्ट्र की तरफ. Sudan, Dr. Sudan, are you from Sudan or you are very much of?
I thought Tamil Nadu, sir.
From Sudan all the way.
I'm from Tamil Nadu, sir. Tanjore.
Ajay, he's from Tamil Nadu. So we have
Sudan.
It is Sudan.
Sudan.
Sudan. It's Sudan.
English is a funny language. You can say Sudan also or Sudan. Anyway.
Sudan in the south is a very nice name, sir. Sudan in south is a very nice name. Sudan.
Acha, it's got a very good meaning.
Yeah, it's a very nice name. Yeah.
Can you tell us the meaning, sir, before we leave?
Sudan.
Sudan. What is the meaning?
It's the other name for Lord Ayyappan, sir.
His voice is cracking. You can't get it.
Sir,
Anyway.
another name for Lord Ayyappa.
Oh, I see. अरे वाह. तो
Ayyappa
प्रभु के
is
दर्शन हो गए ऐसा बोलना है अपने को, है ना? प्रभु के दर्शन हो गए विनर में ही. That's good. So anyway, take care. Nice to see you,
Yeah, bye.
everybody. Thanks a lot,
Good night.
Sai,
You all.
also
Bye. Good
for a
night.
fantastic
Thank you,
matchup.
Good
And
night. Good night. Thank you.
we
All.
thoroughly enjoyed.
Thank you.
Thank you, sir.
Bye. Good night.
Bye. Take care. Good night. Good night.
Thank you,
Bye.
sir. Good night.